And I spend a lot of time and energy trying to undo the damage that that myth brings, because no, pain is never all in our heads. That isn't how pain works. That isn't what pain is. We cannot think our way out of pain. There are cognitive components to pain, but that's not the only thing that pain is. So just to back up and do a little bit broad picture, big science, there's a myth that we've all been sold that pain is a purely biomedical problem. And that's sort of the opposite of what you're talking about. The myth that we've been sold is that pain is purely something to do just with anatomy and physiology. And by that, I mean it lives just in the body part that hurts. So if you have a bad back, usually in Western medicine, you'll go to the back doctor, you'll get a bunch of back examinations, you'll get an MRI scan, and you'll probably be referred for back surgery, and maybe 2 and maybe 3, and maybe you'll be prescribed some medication. And you'll notice that in Western tradition, the way we treat pain is we only focus on the body part that hurts. Why is that a problem? Because the part of the body that ultimately constructs the pain experience is the brain. But to address what you brought up earlier, which is so important, that does not mean pain is all in our heads. And for people who are listening and not watching, I'm using air quotes. Pain is never, and I mean never, all in our heads. Pain is this word, biopsychosocial. And I love this word. I find it so meaningful and so compelling and so illuminating, because no, pain is never just emotional. It's never just cognitive, and it's never just anatomical. It's all of them. It's biopsychosocial always. And I'm happy to break that down if you think it would be helpful.
Please.
Okay, so if you imagine a Venn diagram with 3 overlapping circles, we have biological factors that contribute to pain, we have psychological factors, and we have sociological factors. And I'll say what those are as plainly as I can. In the bio domain of pain, we have the things we've heard the most about, and these are important. We have genetics, tissue damage, system dysfunction, inflammation, even diet and exercise and sleep. These are biological imperatives, and they are fundamentally important to the pain experience. However, if we only focus on the bio domain of pain, we're missing 2/3 of the pain problem. That, of course, is true also if we're only focusing on the cognitive domain of pain or the emotional components of pain. So I said there's 3: bio, psych, social. In the psychological domain of pain, we have emotions. And the way I like to talk about this just in neuroscience language is that the parts of the brain that make emotions also make pain, like our limbic system, our amygdala. Those are, people have heard of those related to emotions, but those are also critical parts of the pain machinery. And what we now know is that 100% of the sensory messages from our body filter through our brain's emotion machinery before they become the thing we call pain. Also in the psych domain of pain, we do have thoughts and predictions and expectations. Of course, those change the body. There's a word for it. It's called the placebo effect. And we know that if you're wearing a white coat and a stethoscope, and if you hand someone a sugar pill and you say, this is the most powerful pain medication we have, you're going to feel better soon, your brain will bump out high levels of homemade opioids and pain volume will start going down. But that's just one part of the recipe. And then we have the sociological domain of pain, and that's everything else. It's socioeconomic status, access to care, race and ethnicity, it's social support or lack of it, it's isolation, which amplifies the pain alarm. It's also history of trauma. We know that trauma is a huge ingredient in the pain recipe. So all of this to say, pain lives in the middle of those 3 domains of pain. It's never just one of those things. So yes, the brain ultimately constructs the experience, just like the brain ultimately constructs the visual experience, the things our eyes take in. But that doesn't mean that pain is all in our head. And I think that distinction could not be more critical.